Okay, hello. This topic, child abuse, is a wide topic. Everybody knows that this kind of problem or situations um, show alarming statistic. The CDC, the American Pediatric Association, Physician Association, and other association every day try to show and to make a call on the different kind of child abuse. And this is also a topic for nurse, for health providers, for doctors, for any kind of health professionals in who are going to take an exam. This is a typical question, the child abuse, the elder abuse that can appear on the exam, but also in our community, as a parents, teachers, professor, grandparents, it should be a concern from everybody. But I was reading the some different research and information that appear on the CDC. As you know, there are different kinds of child abuse. There is emotional abuse, physical abuse. There is a neglect. That neglect is when there is a failure to cover or to assist the child with the basic needs, food, also the clothes, also the school, also the providing help to the school needs, also the medical service for them. Okay, another, the CDC mentioned some risk factors. One of the risk factors, everybody know, that is important for parents, listen, and also for health provider. Everybody talk every day about this, but we want to talk also about other hidden factors. So, the factor that mentioned CDC is that the risk factors are the young or small kids, less than 4 years old, the kids with special needs, kids with diagnosis of spectrum autistic disorder because they cannot communicate as other kids. Also, other kind of kids with mental health problem, they have also the more risk to suffer from sexual abuse or another kind of abuse. Another kind of abuse in parents and caregivers who can perpetrate the abuse are the parents. Is more frequent in parent who has been in jail, also the parent who has been on the who have low socioeconomic situation or low education level, also the parent who has been on a stressful situation, that everybody are in stressful situations. There are other factors, for example, the parents or the caregiver who are who has history of alcohol, of drugs, or mental health problem, or history or has been that have been abused during the childhood. So this is the risk factor that everybody know, but also we need to, for parents, we need to also, it's important to mention some other hidden factors, but everybody know about it at the same time. The family members, the friends, some bigger kids can produce or can be the perpetrator of the child abuse. So sometimes now that we are on the party time, Halloween, we have received some invitation, for example, when there are everybody will be on the house, and with many parents from different places. Some of the parents don't know other parents, or maybe one family member can commit this kind of child abuse. So we should be alert. And my daughter and my son told me every day, "Mom, you are so strict and you sometimes are exaggerate about this situation." There is no a level of provide safety to our kids in this way. All the situation during party situation, with drugs, with the candies, with any kind of problem on the party, the visit of the family on a house, in any place on the also on the playground. When I on the playground, sometimes I call a mother and say, I'm sorry, I am a mother, but your daughter, it's better that you use a short because a lot of parents are looking to her. She's a small child and she's with a skirt and she need maybe a short. My daughter say, "I mom, why you speak with her? She's a mother, but you don't know her." Okay, but this is a way, other way to prevent child abuse, to be involved in any kind of a situation when we see a child abuse. As a nurse, as a health provider, for example, when we are in any kind of nursing or medicine setting, when we suspect a child abuse and the kid is more than 18 years old, we should speak with the kids and maybe, for example, have some sign of being abusing as fractures, of some bruising, and the child is avoiding to speak with any adult, avoiding to, or can show with the toys that that may be the part that they someone touched her or touched him. So there is different way to know as a health provider how the child can be abused. In this case, also we need to try to make an association between the history that the parents say and the physical examination. When we suspect a child abuse, we should report it. We should report, for example, to the authority. You're going to receive an orientation in the hospital, in the nursing setting, the medical setting. But the question on the exam that say what you should do, it should be, report it. It's mandatory to report the child abuse. There are some phone numbers everywhere to report the child abuse. Second, another important fact that is a hiding fact. On the school, many hours of homeworks, of many hours on our kids in the computer. My daughter told me that she have a long homework that take 4, 5, 6 hours to respond this homework online on the computer. I say, how we can communicate with them? When will be the time that they have time to relax from the school? With that, at the time that we provide, we have some family time with them. For example, during weekend, we try to, our family try to practice any sport, to go to any playground with our kids, to any garden. But sometimes my daughter say, "Mom, I need to answer make or audit my homework." I say, "Why?" No, because it will take 4 hours, 5 hours. This is one. The second one, the time that our kids are inside the classroom, it's better. This is a point that we should change. The kids can change of activity, and in some schools that have a big playground, that have a big, knowing in the case of my son that he said that the recess sometimes take 45 minutes or 30 minutes, but why not more games for them and less time using a computer? Third, points. The society and the government also can contribute to the to this child abuse. Why? For example, now recently there has been the refugee people, the immigrant, has been returning, or there has been a lot of person or immigrant without document, and they has been putting on the prison, or there has been put on the way that the ICE has used to say to the immigrant, you need your documents. This has been producing stress in all the families of immigrants. the way that the immigrant has been treated in our jobs. I am an American citizen, but listen, I feel that as if I am an immigrant without document. Because, for example, I was teaching in a school, and in this school, in university, every day I receive an email that I cannot teach, I cannot speak in Spanish with my students. And the second is that the problem with for example, the health insurance, there has been a big cut of health insurance. We know that there has been a lot of fraud and scam and abusing of the Medicaid and Medicare. But why there is not find a way to control or to make more control on the abusing of the Medicaid and Medicaid instead of cut the Medicaid and Medicaid for kids and for other kind of persons. Another important fact in my personal situation is the way that I was fired from my job. I was working with passion, and my daughter and my son told me, "Mom, I do not want to be a teacher or a professor because you love your profession, and you were fired because you was teaching with passion." They asking this question. So the society and the government and the schools and the jobs sometimes make facilitate this kind of child abuse. Another problem is with the aftercare program. The aftercare program is so expensive for some parents. We visit when we couldn't to pay the aftercare program. We see and we found that some kids were waiting for the parent for 4 hours, 5 hours outside the school. We asked them why they were on the school, and they said the parents don't pay. It's not the community problem that the kids are outside the school, this big building waiting for their parents because the parents are working. I don't know, but the community and the society need to invent more programs and to facilitate more programs for kids, for parents who have a difficult situation, with aftercare. There is a program, some clubs in the school, but sometimes those clubs don't work. Because when I was working as a professor, for example, I called to the school and the club do not work some days. Work some day and another day do not work. So there is, the society, the community need to make to provide help in this situation. The government to provide more help for health insurance. The health insurance should be universal for everyone, but not for cases that, for example, and they should provide more control with AI. I don't know, for Medicaid and Medicare abuse. But not to cut the program for people and also the food stamp for people that really need this kind of service or benefit. Another situation that is hiding is how the government or how the organization can stereotype on the families. For example, immigrant families, on people who from other country, or for some different kind of groups, a stereotype on the way that we communicate with our kids, or the way that we to find is we have a criminal situation. I has been here in the USA for more than 20 years, and it's incredible. It's incredible how they are trying to investigate our personal history as if we were criminal. But we have been teaching for many years. We have been providing health service for many years in public health, working with children, working with family members, and it's incredible how he's investigating our personal history as if we were criminal. For them, all immigrants are criminal. They are ignorant. They are ignorant because sometimes they think that all immigrants, that all people from other countries, they can be a criminal. And this is stereotyping. This is a way to abuse also from family, to provide also, to be abused also on children. So for this reason, we consider that the aftercare, the homework, the education, the health insurance, that the way that the government treat immigrants, the way, the approach that the different organizations, and Florida National University and other organizations, private, any kind of organization, that they fire a worker, they need to find the best way to fire a woman with kids, to fire a person with family member who have cancer, has my situation. I didn't find support in my family and in my university when my husband has cancer. With 2 kids, I was fired. I was fired because I was teaching with passion. I was fired because I am a mom that tried to pick up and drop off my kids by myself. I was fired because I was listening to all my students with different, that are mother, with different kind of mental problem, with depression, because are immigrant. And this is the way that the society and the government also can stimulate and provide the child abuse. It's not only use the artificial intelligence to see if any immigrant are criminal. They should see and they should check to themselves how they can provide and stimulate more program for family members, for kids, for women. Because, for example, another problem, I apply for the equal employment law to complain about my situation. And they didn't answer. They did not provide a schedule. This is unfair. This is another unfair situation, and our kids are looking for any kind of situation. So, again, this is a difficult time, and we as a society, the government also, can stimulate, can produce, can increase the child abuse and the family abuse and the difficult situation in the family. Thank you.